Hi, everyone. My name is Denise Octavia Smith. I'm a community health worker, a patient navigator, and in November 2019, I had the great honor and pleasure to become the founding executive director of the National Association of Community Health Workers. Thank you so much for clicking on this link and joining us to celebrate and to recognize with the National Association of Community Health Workers this important month of September 2021. We want to recognize and highlight the ways that community health workers and the communities where we live and serve can help to promote and prevent suicide. And so with me as a special guest, I want to welcome Miriam Delphin-Rittmon. She is the Assistant Secretary of the Substance Abuse and Mental Health Services Administration. Miriam, thank you so much for joining us.
Oh, thank you so much for the invitation. And I so appreciate just the opportunity to be able to have this important conversation.
Wonderful. Well, we're just going to spend the next couple of minutes talking about why we're acknowledging this month of suicide awareness prevention. So why don't you start by just giving us a level set? Why is it so important that SAMHSA is observing Suicide Prevention Awareness Month?
Yeah, it's such an important month for us to observe. I mean, it creates an opportunity and a space to share information, to let people know that suicide is preventable, that treatment is available, recovery is possible. And so it's just critical to create that space. We know that, currently suicide is the 10th leading cause of death in the country. And so raising that awareness that there are services and supports that are available that people can connect with if they're struggling, I think is particularly critical.
And Miriam, what do we need to know right now about who is most impacted by suicide and the related mental health in the United States? And if you can give us some insight into why that is.
Yeah. It's such an important question. When we look at data, it's important to know that sort of no demographic group is exempt really from suicide risk. And our data does show us that. That piece is important because we don't want people to have a false sense of security that, if I'm not part of this group, then I'm okay, or I'm not okay. And so we know that the causes of suicide are complex though, and multiply determined. There are certainly risk factors. So while there's no demographic group that may be particularly at risk more so than any others necessarily, there are risk factors. And when we look at trends, we do see some trends based on demographics. So for example, risk factors, we know one is if a person has a previous history with suicide attempts. Or if they're feeling hopeless or helpless or have anxiety or mood disorders, that sometimes can be a risk factor as well. Yeah. When we look at demographics, there are some trends that suggest some groups, have higher rates of suicide, but may not necessarily have higher rates of risk. And I know that sounds like a contradiction. But I will talk a little bit about some of the higher rates. So for example, Native American youth, is one demographic group where we see high suicide rates. Also, some of our current data suggests that African-American individuals, particularly young people, have increased rates of suicide when we look over the last 10 years or so. So those are just two examples. Veterans, we know also is a group that may be at risk, and their suicide rates have been on the rise as well.
And many of the communities and populations that you just referenced could be experiencing increasing or even more disproportionate risk because of the pandemic. So, I know that many people on this call working on the front lines in public health, you're working in research, you're working at a community-based organization, you perhaps are a faith leader, an educator. We know that you're interacting with so many of these populations in different settings. So it's important for us to recognize that there can be multiple risk factors and layers, and we want to be sensitive to that.
Yeah, and I think that's a
Knowing that we
really
have
important piece. That's a really important piece that, you know, no group is exempt from risk. I think that's really the point that it's important to share. No group is exempt, and there may be different risk factors within different groups. And so I think that is a piece that is critical from a cultural competence, from a health equity perspective.
Agreed. So, because I know we have a diverse audience here, NACHW members are individuals and organizations. We've got membership in 48 states and many more who are our partners and supporters in different ways. Can you share with us some best practices that SAMHSA is promoting, that you're learning, that will help us advance racial equity when we think about access to care for, again, these diverse populations that you've lifted up who may be experiencing a mental health or substance use issues?
Yeah, I appreciate that question. So, you know, one area of best practice that we're working on is continuing to elevate and lift up the cultural and linguistic competence standards, the class standards. We know the class standards are a set of 14 standards that essentially help to give organizations 15 standards, really. There's a primary standard and then 14 others, so 15 total technically. But it helps to outline competencies that organizations and communities can think about in terms of promoting cultural competence. So things like communication, paying attention to linguistic competence, paying attention to within an organization, sort of looking at data and using data in a way to inform programs and inform outcomes. So, you know, SAMHSA, we're continuing to promote and elevate the class standards. Recently, we worked with the Office of Minority Health, and Office of Minority Health has put out the Behavioral Health Guide to the class standards. That document, I think, is particularly important because it outlines approaches within behavioral health for continuing to promote equity and cultural competence within services and programs and systems. And so that's one area of work that we're continuing to move forward. We do ask, in fact, that our grantees, so grantees that have our discretionary grants, so grants that they've applied for competitively, they actually have to put together a disparity impact statement. And so what that is they indicate disparity populations or populations within their region that may be at risk for disparities. And as part of their grant, they have to indicate how they're going to address the needs of that particular population and how they're going to use the class standards to address any disparities that may emerge or that they're aware of within their region. So those are just a few examples.
Wow, I love both of them, and I think time wouldn't allow, but for those who are not familiar with the class standards, I'm a big champion. A lot of CHW programs around the country embed that knowledge into the work so that CHWs can also advocate in the systems and sectors, the nonprofits where they're operating. And I love that plan around the impact statement for racial health equity. I just think that that helps to undo and to bring not only the downstream benefit in terms of the delivery of services, but it also begins to repair some of the historical inequities that are found in our systems and policies. So you see, I'm wearing my I Love CHWs button. I'm a community health worker. I have been for a few decades.
Awesome.
Grateful for my mentors and allies who support my work. And so I want to speak directly to the CHWs, the promotores, the community health representatives on tribal nations, our peers, our outreach workers, our navigators. You know, we've got dozens of different titles, but I want to speak to our community, those who are trusted, those who have shared life experience, those who have a compassionate and culturally appropriate service delivery approach, and those who want to build capacity in community. We want to nourish and make communities better. So what are some of the ways that community health workers can support this awareness or some of the implementation of what you've mentioned as best practice among their clients and communities?
Yeah, no, great question. I mean, You know, the thing that I so appreciate about community health workers is that they are truly working sort of in the field alongside so many different groups of people and can work and are in so many different spaces. And so that creates just a range of opportunities for community health workers to share information about best practices, whether it be the work that they do in schools. You know, there's real opportunities to disseminate information within school settings, or in any other community setting. So models like, for example, the QPR, question, persuade, refer, to the extent that, you know, community health workers can really just avail themselves to the range of training opportunities that are out there, and then disseminate that information community-wide, and use that information both with their clients and with other organizations that they may be working with. So that is so critical. You know, I think community health workers can also just share information related to the resources we know that are available. So, you know, for example, the Suicide Prevention Resource Center. You know, that is a resource center that is continually being updated real time. And so to the extent that workers are able to go to that site regularly, get updated on information and share that as they're working out in the field, you know, I think that can be another real valuable way to disseminate information. So those are just two strategies, but the list is endless, because community health workers, again, just totally meet people where they're at. And sometimes the beauty of the work is just their presence, you know, just being there, and having strong listening skills. You know, how can I help you today? Goes a long way for often when people are struggling.
Oh, thank you very much. Those are fantastic. And we will do our due diligence and make sure that we share those, not only this month, but we'll make sure there are resources on our website. We know we've heard from the data as we've been in this global pandemic, you know, more than 18 months now, that risk factors are increasing as our communities continue to experience sort of waves of high risk, of lack, of loss, of concern, of anxiety. They continue to press forward and keep their families and their communities safe. So we'd be happy to share those resources. I also want to encourage people to look at the NNED, the National Network to Eliminate Disparities. Make sure you have that correct. But that's a wonderful resource of sharing for community-based organizations and others of what's working. And I love it and have used it over many years. So you can become a member, it's free. You just answer a little bit of information, and then you can search for interventions and activities, and also connect with others around the country.
And there are webinars.
Oh, that's true. Well, that's very true. And,
Yeah.
and that leads me to my last question, which is, you know, I know we're sort of in the middle of the month. Are there events that are coming up in the next couple of weeks that SAMHSA is hosting in this month of observance that, you know, you really want CHWs or a broader community of listeners to learn about or to tap into?
Yeah, thank you. Thanks for that question. Yeah, I mean, so certainly one, I would say, you know, definitely check out the NED, so the National Network to Eliminate Disparities. That website has, you know, it lists the different webinar series that are available. Currently, there is a series related to Elevate CBOs, so Elevate Community-Based Organizations. You know, another really important website, again, to get updated on all the different events that are happening are the Suicide Prevention Resource Center. Again, that would have events listed. We did have a number of events that took place during Suicide Prevention Week, which is September 5th to 11th. And so those are events likely that we'll be running some version or updated version certainly next year. But a range of events that took place this month, particularly September 10th, we know was World Suicide Prevention Day. So there were some resources and events related to that. And so definitely check that out. There's Twitter chats. There was a lifeline. So the, you know, Suicide Prevention Lifeline, there was a Twitter chat on September 10th. There was also a Twitter chat on September 1st that was put on by the Action Alliance. So we packed a lot in the first couple weeks of the month, knowing that Suicide Prevention Week in particular was the 5th to the 11th. But certainly if folks check out the Suicide Prevention Resource Center website, there are other resources and information there about any other events that may be plugged in moving forward.
Okay, perfect. Well, I hope that this is the first in an ongoing discussion between the agency and the National Association of Community Health Workers. For everybody who's listened in to the video, thank you so much to Miriam Delphin-Rittmon, the Assistant Secretary of the Substance Abuse and Mental Health Services Administration. Please make sure that you click on the links that NACHW is going to share with this video. And, you know, we know that this is a month, a few weeks of observance. This is something that we just need to integrate into our daily lives and into our practice. We know that mental health issues can be upstream indicators of other downstream chronic disease. We want to make sure that people, that we are considering the whole health needs of individuals, families, and communities. And so CHWs, if you're not already engaged in this work and you don't have this training, reach out to SAMHSA as a resource for free trainings, for webinars, for toolkits and fact sheets and resources, and educate yourselves and your community. Again, Miriam, thank you so much. Stay safe and all the best to you as you continue in your work.
Oh, thank you so much. Thank you for the invitation, and you take care as well. Look forward to continued conversations.
Wonderful. All right, thank you.
All right, take care.